My name is Keith Bly. I'm the Senior Vice President of Product Development at NovaBay Pharmaceuticals based in Emeryville, California. Today we announced some very remarkable efficacy data regarding our new auriclosene catheter irrigation solution. The results show a significant reduction in the amount of incrustation and blockage following episodic treatment of catheters with the solution relative to saline. Saline is the standard of care in the United States. So this product represents a potential to significantly prolong the patency of indwelling urinary catheters, which would be a very, very important consequence for patients with these catheters, because then they don't have to suffer unpredictable catheter changes. They don't have to endure the even potentially life-threatening consequences of autonomic dysreflexia, which comes about from the catheter being blocked. In theory, they should have a reduced rate of urinary catheter infections, and just overall, it should produce a significant improvement in their quality of life.
For the industry, a problem that we have this morning or yesterday morning, CDC came out with their first white paper on antibiotic resistance. How many of you got a chance to saw that in a show of hands? I mean, it's the first time CDC is saying, hey, we have a problem. So we're really addressing some major problems in that space vis-a-vis our technology. I'd like to introduce Dr. Spencer Long. He's going to introduce you to challenges in urology, and then Dr. Wild, and then Dr. Lindermeyer, please.
Patients who have urinary catheters in their bladder always get bladder infections within a few weeks. Catheter is placed in the bladder. It's a foreign body sitting in the urine, and bacteria are able to go up through the urine channel into the bladder, and invariably within a couple of weeks the patient has what we call bacteriuria, which means a full growth of bacteria in the bladder. They develop fever or other symptoms of severe infection. They get treated with an antibiotic, but within a few weeks they're back with bacteria again. And what this product does is to kill bacteria, and it kills it in a different way than antibiotics, and that's the unique thing about it. And it kills it on contact. It's not something that has to go into the bloodstream. So right now you can give a patient antibiotics, but it's not going to permanently get rid of the bacteria in the bladder. But this product, which is designed to be used, the president's recommended twice a week, will kill those bacteria, and it will kill the bacteria that are hiding in these stones and all the products. So it's unique. It's different than antibiotics. There's no other way we have to do this right now.
So what you can get from this picture is that people are dealing with severe problems frequently, and they really don't have anything. They don't have anything to help them. I mean, I'm teaching them not to pull on the catheter, and also to drink optimal and consistent levels of fluids, especially water. But that's kind of minor in comparison to what they really need. This gives you an idea of the number of people who had frequent blockages. These are true blockages, just not the catheter slowing down. It meant it totally stopped and obstructed the flow of the urine inside the catheter. I also did a study with 43 people over an 8-month period, 2 months retrospective and 6 months prospective. These are people from all over the country. It was an internet-based study, mostly spinal cord, but we had other people in this population. And in that sample, 70% in that 8-month period had blockage. So you have some people who have an awful lot of blockage and very frequently are dealing with this problem. But there are a lot of other people who have blockage, and that's blockage within the catheter. It not only affects their quality of life, it causes a lot of extra healthcare costs, emergency room visits, the hospital visits, and it's emotional load on the family too, because when the catheter's not working and you have to call a nurse out to come in the middle of the night, which now they do, Years ago, believe me, the patients just went to the emergency room because I was a home care nurse at that time in the 70s and the 80s. It's a problem, and everybody feels it. Also, if your catheter's blocking a lot and you're trying to hold down a job, it's really difficult. So especially the people who are younger, those are typically the people with the spinal cord injury, 20s, 30s, and they have a potentially long life, especially with good urological care. But it affects their ability to hold down a job when their catheter keeps blocking and they can't manage it, and they start leaking. It's a hard thing to solve. In my last study, we found that people had excess nurse visits, clinic visits, emergency department visits, as well as catheter changes, all because of blockage. And there was a large percentage of people who had all those extra costs, not to mention the cost of irrigating.
I'm the Director of Urology at Kessler Institute, and I've been there about 25 years, and I'm pleased to have a chance to talk today. We see approximately 3,000 outpatient spinal cord visits a year, and I wanted to begin by, I was asked to have an interview with one of our patients with regards to their catheter and give a few insights on that, so I think we'll begin with that. We really don't have real satisfactory ways to manage bladder stones. Carl's a good example that we just do the best that we can, but we really do need better ways of management for this problem.
We had a nurse come in for a little bit in the beginning to help us learn how to change the Foley catheter. While she was doing it one day, we couldn't get it back in, and I had to be rushed to the hospital. The day I was rushed to the hospital in the beginning was a headache I know what it can feel like, and I don't ever want to feel that again. So there's silent ones too, where I'm sleeping, and if it blocks during the night when I'm in bed, it's almost to the point where it's too late when I wake up. My head, I can't even move. I have to yell like, "Glor, I got major headache, something's going on," and of course it's a blockage.
One of the issues sometimes he says if he's at a party or something, we'll suddenly have this blockage and not realize it till his pants are soaking wet and has to say, "We gotta go now," and he takes off real quick. Well, what happens is that when the bladder gets blocked, there's a whole lot of pressure then that develops in the bladder wall, and then the urine will leak out around the sides of the catheter and the urethra. But the other thing that happens is when the bladder stretches, it's a trigger to tell the bladder it needs to squeeze harder. So the bladder squeezes really hard, and that shoots the urine out around the catheter as well. That's particularly an issue in women as well, with this very short urethra. With regards to some of the social problems, individuals may limit their activities because they're afraid their catheter might block. They have embarrassment because of problems from this catheter blocking and leaking, or getting a sudden episode of this flushing and everything in front of their friends. And also, there's a constant worry that people always have that there's something might go wrong with that catheter as well.
What this product means for the patient is they're going to have less catheter changes by twice a week irrigation. They simply change their catheter once a month instead of once a week. So imagine 52 catheter changes a year is going to be reduced to 12 catheter changes. That gives them a lot of freedom, a lot of quality in their life back. A catheter change is just not a catheter change. They have to be transported to a hospital. These are quadriplegic, paraplegic patients. A van has to come in, take them to the hospital, take them to the clinic. They have to wait almost an hour and a half to get their catheter changed, and then after the catheter change, wait another hour or so to make sure the patient is stabilized. It's a half a day process. And what it means for NovaBay is we're going to have a product that we could build a sales force around, focus on the 52 or so spinal cord injury centers around the United States, and be able to offer a product that really will be transformative for the patients, and also it will be transformative for NovaBay.